overview of the liver.
The liver is a reddish-brown meaty organ with two lobes, which situated upper right of the stomach and below the lungs or diaphragm. It is classed as a gland and part of the digestive system. The liver is the second biggest organ next to the skin and the largest solid organ in the body, weighing around 1.5 kg with size equivalent to the size of a football. This vital organ carries out more than 500 essential tasks in human body. The liver is the only organ that possesses the capacity to regenerate. Alcohol abuse is one of the major causes of liver problems in the industrialized world.
Functions of the liver.
The primary functions of the liver are bile production. The liver produces and secretes bile for digestion. Metabolic functions. The liver metabolizing carbohydrate, protein and fats into energy. Nutrient storage. The liver stores significant amounts of vitamins, glycogen and minerals. Synthesis and secretion. The liver synthesizes plasma proteins, clotting factors, cholesterol and hormones. Detoxification. The liver detoxifies drugs and alcohol and excreting bilirubin, hormones and cholesterol. Protection function. Resisting infections by making immune factors and removing bacteria from the bloodstream. Regulation mechanism. The liver regulating blood sugar level, blood clotting and hormones balance. Erythrocyte disposal. Destroys aged or damaged RBC, clearance of bilirubin and processes of hemoglobin.
Liver diseases and failure.
Having a healthy liver is an essential key to living well. Liver disease is any condition that causes liver inflammation or damage and may result in liver failure. The liver failure can lead into poor health, or worse, which can be life-threatening.
There are many different types of liver disease. The most common one are hepatitis, inflammation of the liver, acute liver failure, loss of liver function within days or weeks in a person who has no pre-existing liver disease and it can be life-threatening. Liver cirrhosis, a late stage of fibrosis or scarring of the liver. Alcoholic liver disease is damage to the liver and its function due to alcohol abuse. Liver cancer, the growth and spread of unhealthy cells in the liver. Autoimmune liver disease, in which our own immune system attacks the liver. Inherited liver disease, which a group of metabolic and genetic defects that typically cause early chronic liver involvement. Stages of liver failure. Even though there are many types of liver diseases, the damage to your liver is likely to progress in a similar way. Stage 0, healthy liver, without any damage and with optimal functionality. Stage 1, inflammation. Early stage of liver failure, the liver becomes inflamed or enlarged. Stage 2, fibrosis. An inflamed liver begins to scar. Stage 3, cirrhosis. There is irreversible scarring in the liver. Stage 4, liver cancer. Liver cancer is development and multiplication of unhealthy cells in the liver. Stage 5, end-stage liver disease, ESLD. During this stage the liver function ceased almost entirely and condition of the liver can't be reversed other than a liver transplant. Causes of liver failure. Infection. Alcoholism. Drugs and chemicals. Autoimmune disease. Obesity and diabetes. Genetics. Symptoms of liver diseases. Jaundice. Swollen legs or ankles, abdominal pain and swelling, cheese skin, dark urine and pale or bloody stool, persistent fatigue, nausea or vomiting, loss of appetite, tendency to bruise, weight loss. Diagnosis of liver disease. You will need a blood screening if any of the following apply to you. To monitor side effects of medications. Experience symptoms of a gastrointestinal or liver disease. Having current or previous liver problem. Liver imaging test result was abnormal. engage in unhealthy lifestyle like alcoholism, having certain medical conditions like diabetes, hypertension or high cholesterol. A group of blood tests called liver function tests can be used to diagnose liver disease, by measuring the levels of proteins, liver enzymes, and bilirubin in the blood. It can tell how well the liver is functioning, how severe is the liver problems, and identify liver disease. The liver function test generally including the following tests. Bilirubin. Bilirubin is a waste product from the normal breakdown of red blood cells and is excreted in stool by the liver. When liver failed to excrete bilirubin from the body, the bilirubin level in the blood will increase. So elevated levels of bilirubin might indicate liver dysfunction, liver damage or disease, blockage of bile ducts or certain types of anemia which can result in jaundice. Total protein. The total protein test measures the total amount of protein in your blood, which consist of albumin and globulin. This test will also look at the ratio of albumin to globulin in the blood. This is known as the Ag ratio. Elevated total protein can be a sign of chronic liver infection or inflammation, while decreased total protein normally associated to liver disorder. Albumin and globulin. They are protein made by the liver. Albumin functions primarily as a carrier and regulate the oncotic pressure of the blood. Globulins help transport nutrients and fight infection. The test compares the amount of albumin with globulin and calculates the Ag ratio. Low Ag ratio may be caused by liver autoimmune disease or cirrhosis, while high Ag ratio suggests underproduction of immunoglobulins. Alanine transaminase, ALT, and aspartate aminotransferase, AST, ALT and AST are enzymes found in the liver that helps metabolize protein or amino acid. They are usually moderately elevated, 4 times, in chronic hepatitis, cirrhosis, obstruction of bile ducts and certain liver cancer, and usually AST is higher than ALT. Very high level of ALT and AST, 10 times, is usually due to acute hepatitis, and normally ALT higher than AST. ALT and AST level may markedly elevated, 100 times, as a result of exposure to drugs or toxic substances. Alkaline phosphatase, ALP. ALP is an enzyme found in the liver and bone and is important for metabolize proteins. Elevated ALP may indicate liver disease, bile duct obstruction, or certain bone diseases. ALP results are usually evaluated along with other tests for liver disease. In some forms of liver disease, such as hepatitis, ALP is usually much less elevated than AST and ALT. When the blockage of bile ducts, ALP may be increased much more than AST or ALT. ALP may also be increased in liver cancer.
Gamma-glutamyl transferase (GGT). GGT is an enzyme found in many organs, pancreas, spleen and kidney, with the highest concentrations in the liver. GTT can be elevated in early liver disease, making it a highly sensitive marker, yet it is not specific as it can be elevated with a variety of liver diseases, and after heavy alcohol use. However, GGT result is useful if interpreted along with ALP result to rule out the bone disease, in which an elevated ALP with normal GGT is more likely due to bone disease, while with liver disease both GGT and ALP are elevated. Alpha-fetoprotein (AFP). AFP is normally made by a fetus's liver and is used to check a developing fetus for risk of birth defects. However, in non-pregnant adults, AFP can be a tumor marker to diagnose liver cancer. To monitor cancer treatment or see if cancer has returned after treatment, and to monitor liver conditions like cirrhosis or hepatitis.
Please take good care of your liver, and thank you for watching this video.